If you can dream it, you can do it. Because the dream, what you see, if that is within your reach, you can do it that. But if you have the dream which is beyond the reach of the human being, that cannot be. So just have the dream which you can do it. Now, the generalized tetanus, it is the most common type of the tetanus. It presents about 80% cases. It presents with the ascending pattern, so also called descending, descending pattern. It presents with the descending pattern, so also called descending tetanus. The first sign is trismus or lockjaw, and facial spasms are called rhizus sardonicus, followed by the stiffness of the neck, difficulty in swallowing. There is rigidity of the pectoral and the calf muscles. Other symptoms include fever, sweating, hypertension, and rapid heart rate. Spasm occur frequently, last for several minutes, giving characteristic shape called opisthotonous posture. I have already shown you the picture of all these. Spasms continue for 4 weeks and complete recovery may take many months. So here one can see the tetanic triad, that is trismus, lockjaw, mild severe spasm of the lower jaw, so leading to the trismus. Then rhizus sardonicus, that is sardiman grin, and grin is caused by the facial muscle spasm, and opisthotonus, it is severe simultaneous spasm of all the muscles to give this opisthotonous posture, the classical of the tetanus. Now, the second type is neonatal tetanus. It is also called trismus nascentium, a generalized tetanus seen in the newborn who are born to the mothers not being vaccinated properly before going to have the pregnancy. If mother is vaccinated against tetanus, infant acquires passive immunity and so protected from tetanus. It occurs via infection of the unhealed umbilical stump when stump is cut with a non-sterile instruments like scissors and knives, as in the rural areas do happens, responsible for this tetanus. In 1998, neonatal tetanus was about 14%. Now, after vaccination, this incidence has reduced by 90%. So here one can see the neonatal tetanus seen in the newborn whose mother have not been vaccinated. Similarly, this child is also having the neonatal tetanus. The third type of the tetanus is local tetanus. It is an uncommon form of the tetanus with persistent contraction of the muscles in same anatomical area as the injury. Suppose if a person have got the injury to one arm, there is persistent contraction of the muscle in that arm, that is called a local tetanus. The contraction persists for many weeks, then subside. Toxins diffuse to affect relevant level of the spinal cord. It is milder, 1% of the cases are fatal, may precede onset of the generalized tetanus. So these symptoms can lead to the generalized tetanus also. Number 4 is cephalic tetanus, a rare form, about 0.9 to 3% of the cases, limited to the muscles and the nerves in head. It occurs after trauma to the head area like skull fracture, laceration, eye injury, dental extraction, and otitis media, causing this cephalic tetanus. Also seen from the injuries to the other parts of the body. Paralysis of the facial nerve mostly occurs, which may cause lockjaw, facial palsy, or ptosis. Other cranial nerves can also be affected in this head injury. may progress to the generalized form of the tetanus with fatality rate is about 15 to 30%, which is very high. Its treatment is complicated as the symptom may be confusing. Number 5 is ascending tetanus, intermediate stage between generalized and the local tetanus is the ascending tetanus. Then number 6 is the descending tetanus. It occurs when the neurotoxin, the tetanus toxin, is given IV. Spasm will appear in muscles of the head, neck, and spreads downward. So that's called descending tetanus. The other types of the tetanus which are not of much importance are number 7, traumatic tetanus, that is because of the trauma. Then 8th is puerperal tetanus, that is after the delivery of a child, that is puerperal tetanus. Autogenic tetanus, as the name is, that is due to the infection in the middle or the inner ear. Then idiopathic tetanus, when the cause of the tetanus is unknown. And 11th and the last is uterine tetanus, that is due to DNC, which is done for the abortion by unsterilized instrument and unskillful workers, that is causing the uterine tetanus. Now, what are the complications of the tetanus? Number 1 is laryngospasm, uncontrolled, involuntary tightening of the vocal cord, that is called laryngospasm. Then skeletal complications like fractures, broken bones, intramuscular hematoma, and muscle rupture. Number 3 is pulmonary embolism, the blockage of the main artery of the lung or one of its branches causing the pulmonary embolism. It occurs by a blood clot that has traveled from anywhere in the body through the blood and reaches and causing the blocking of the main artery of the lung. Then number 4 is aspiration pneumonia, a lung infection that develops when the things like saliva or the vomit go into the lung and causing the aspiration pneumonia. So complication continuing, atelectasis, incomplete expansion of the lungs also occur as a complication of the lung besides aspiration pneumonia. Then there is breathing difficulty also. Number 5 is cardiovascular complication, that is tachycardia, persistent hypotension or hypertension. Then number 6 is nosocomial infection, that is decubitus ulcer, the infection from the skin that can just travel by the bacteria which are present on the skin can get the entry. These are just the normal bacteria of the skin can go and cause the problem. Then number 7 is laceration of the tongue, lips and the buccal cavity because of the spasm and the generalized convulsion. Then GIT problem, bowel infection due to the autonomic dysfunction. They are not allow the bowel to clear because of the dysfunction, peristalsis. Then number 9 is renal, urinary retention, hemoglobinuria, and main causes of the death are respiratory failure, pneumonia, and cardiovascular abnormality leading to the death of the patient with tetanus. This is one of the very rare and unbelievable picture, but I think the love, true love, that can just mold anyone and then that can just give that impression to a tiger who is in a habit of eating the deer, but the deer who is very dear to this lion is just having the fun with that. It's unbelievably rare picture, and it is a true picture, not made picture. Now, what is the diagnosis of the tetanus? It includes clinical diagnosis microscopy of the specimen or the other test, culture and identification, and toxigenicity test. So the number one, the clinical diagnosis, primarily by the clinical symptom, which are very classical, like trismus, rhesus sardonicus, Tetanus posture. Wound may not be obvious, but history of the injury is positive in 50% cases. If you are not able to see the wound, you have the doubt about 50% chance of having the injury positive. Then there is a test which is called spatula test. A clinical test for the tetanus involves touching the posterior pharyngeal wall with a soft tipped instrument and observe there. A positive test will show the involuntary contraction of the jaw biting down on the spatula, and a negative test shows gag reflex to expel the foreign object which have been used to touch the posterior pharyngeal wall. Spatula test had a high specificity. It is zero false positive test result, and it has got high sensitivity, that is about 94% sensitive. Here one can see the spatula that is being touched in the posterior pharyngeal wall, and the positive test is the patient is biting the spatula very strongly. So this is positive test. Now, number two is the microscopy of the specimen, and the other test to diagnose the tetanus, wound exudate or the tissue removed from the wound showing typical drumstick bacilli, not diagnostic or reliable, simple microscopy not successful, immunofluorescence microscopy with a specific stain is done, it only help in confirmation. Then electromyogram shows continuous discharge of the motor units, as I have told you that the excitatory pattern is there, but the inhibitory pattern has been blocked. There is shortening and absence of the silent interval muscle enzymes level may be raised also. So here one can see the immunofluorescence microscopy. So here is immunofluorescence microscopy, and here there is the electrical signal recorded from a contraction. The muscle is called electromyogram, and one can see the pattern of the electromyogram. And if there is no gap in between and there is a continuous contraction, it just indicates the patient is having the tetanus. Number three is the culture and identification. Obligatory anaerobes all produce same toxin, grow on the Robertson cooked medium, material inoculated on one half of the blood agar plate produces a swarming growth, and detected on the opposite half of the plate after 1 day of the incubation. Anaerobically, identification is the bacteria produces indole, has terminal spherical spores on microscopy, not produce acid from the glucose by the biochemical test. And addition of the polymyxin B, to which Clostridia are resistant, makes the medium more selective. Now, number four is toxigenicity test. It is done in animals. Control mice are protected with tetanus antitoxin. 2 mice, one unprotected and the other protected with vaccine are used for each test. Both are given tetanus neurotoxin, and the protected mouse remains well, but the unprotected who has not been given vaccine develops signs of the ascending tetanus. Proof of the isolation of the Clostridium tetani rests on production of the toxin and its neutralization by the specific antitoxin. Now, what are the differential diagnoses of the tetanus? Diseases or the drugs which give symptoms similar to that of the tetanus are rabies, meningitis, encephalitis, strychnine poisoning, phenothiazine poisoning, diseases of the jaw or the throat, low serum calcium level, dental abscess, subarachnoid hemorrhage, hysteria, and status epilepticus. These mimic and give the symptom which are similar to that of the tetanus. Now, coming to the treatment, first the severe tetanus, because it is life-threatening, so admission to the intensive care, a human tetanus immunoglobulin injected intrathecally, tracheostomy and mechanical ventilation is used. Tracheostomy to secure airway because endotracheal tube is a stimulus for the spasm in throat. Magnesium sulfate intravenous infusion to control spasm and autonomic dysfunction due to the tetanus. Now, severe tetanus, in this case, diazepam or other muscle relaxants with a continuous IV infusion to control the muscle spasm is given. Autonomic effect of the tetanus difficult to manage because alternating hyper and hypertension, hyperparexia and hypothermia is very difficult to treat simultaneously. It required IV labetalol, magnesium, clonidine or difedipine sometime. Now, treatment for the mild tetanus, tetanus immunoglobulin, TIG, or the tetanus antibodies or tetanus antitoxin, the one and the same thing that is given as intravenous therapy or by intramuscular injection, antibiotic to reduce toxin production, metronidazole intravenous, IV by mouth or by rectum because it is a very good antibiotic for the anaerobes, benzodiazepine to control muscle spasm, diazepam and lorazepam oral or IV. Even with that treatment, 10% of the people do die. The mortality rate is higher in unvaccinated people and people over 60 years of age. Now, continuing the treatment, proper nutrition and intake of 3,500 to 4,000 calories and 150 gram of the protein per day is given in liquid form via a tube directly into the stomach, percutaneous endoscopic gastrostomy or via vein parenteral nutrition. High caloric diet is necessary for increased muscle activity, that is because of the spasm and contraction. Full recovery takes 4 to 6 weeks because body regenerate destroyed nerve axon terminals. The antibiotic penicillin may be given, but it provokes spasm and it inhibits GABA receptors already affected by the tetanospasmin toxin. So here the landscape which have been made so artistically beautiful that one cannot believe that it is the so skillfully man-made. It is really a thing to see and a thing to remember. The effort of the human being, really marvelous. Now, what is the prevention of the tetanus? Unlike infectious diseases, recovery from the acquired tetanus not result in immunity as in the other infectious diseases. This is due to the extreme potency of the tetanospasmin toxin. Tetanus is prevented by vaccination with tetanus toxide. Adults need a booster vaccine every 10 years. Give booster to any person with a puncture wound, uncertain of when was last vaccinated or booster was given, or if one has had less than 3 lifetime doses of the vaccine. So just give vaccine and tetanus shot to protect someone. Now, prevention in children below 7 years, tetanus vaccine is given as a combined vaccine, DPT, DTaP vaccine. For adults and children more than 7-year-old, TD vaccine, tetanus and diphtheria, or TDAP, tetanus, diphtheria, and acellular pertussis is used. Post-exposure prophylaxis, tetanus toxide in case of the suspected exposure to the tetanus. It can be given with or without tetanus immunoglobulin, tetanus antibodies, or tetanus antitoxin to neutralize the bacteria which have got entry into the blood. It is given as intravenous therapy or by intramuscular injection. So here one can see the tetanus vaccine or TDAP vaccine or tetanus toxide adsorb, and the other is the DT vaccine which can be given to the children and adults. And continuing the prophylaxis, the available method of prophylaxis are surgical prophylaxis, antibiotic prophylaxis, and immunoprophylaxis. These are three kinds of the prophylaxis which are available in case of tetanus. So the first is surgical prophylaxis, prompt and adequate wound dilate and proper surgical debridement of the wound, removal of the foreign material, necrotic tissue, and the blood clot to prevent an anaerobic environment or the condition for the growth of the Clostridium tetani. Now, the second is antibiotic prophylaxis. Antibiotic destroy or inhibit Clostridium tetani and the pyogenic bacteria in the wound, so production of the toxin can be prevented. Metronidazole intravenous IV by mouth or by rectum, as I have told you already, that is very good for the anaerobic bacteria. Long-acting penicillin injection is drug of choice, and the alternate is erythromycin for the people, those who are sensitive to the penicillin. Antibiotic prophylaxis does not replace immunoprophylaxis, but it serves as useful agent because it stops growing the bacteria and releasing the neurotoxin. Third is the prophylaxis, immunoprophylaxis. It includes three types of immunization. Number one, active immunization. Number two, passive immunization. And number three, combined immunization. Number one is active immunization. Tetanus is best prevented by the active immunization with tetanus toxide. Two preparations are available, combined vaccine DPT or monovalent vaccine. These just start producing the antibodies in the body to prevent the tetanus later on and to combat the tetanus bacteria if the antibodies are already in the body. Number two is the passive immunization. It is done by giving already formed antitoxin. The antibodies which have been made against tetanus bacteria already, these are called passive immunization. Then passive immunization has got temporary protection against tetanus by an injection of ATS or a human tetanus hyperimmune globulin TIG. Anti-tetanus serum from the hyperimmune horses was originally used. Dose is 1500 international unit, given subcutaneously or intramuscularly in non-immune person after receiving after any tetanus prone injury. These are given when a person do have any injury and any tetanus have not been given to him. ATS gives passive protection for 7 to 10 days. The other is among the passive immunization is human anti-tetanus immunoglobulin HTIG. This is effective in smaller doses. 250 units by intramuscular injection is given as an alternate to the ATS. So here one can see adsorbed tetanus vaccine, and that is a DPT vaccine for diphtheria, pertussis, and tetanus, and that is antitoxin, the antibodies of the tetanus already formed, and then it is TIG, anti-tetanus immunoglobulin. These are just able to combat that tetanus bacteria. Third is combined immunization. It consists of giving to a non-immune person ATS or HTIG at one site plus adsorb toxide at the same time at another site, followed by the second and the third doses of tetanus toxide at appropriate interval. So, people of all ages need tetanus vaccine. Here, the children, for younger children, TTAP 2, 4, and 6 months, 15 through 18 months, 4 through 6 years. So these are the vaccination schedule. TTAP for parents 11 through 12 years and TTAP every 10 years, that is given just to protect the people of all ages. So that is the end of the tetanus. I hope so. You may have liked this, and if you have liked this, please prescribe this and share it with others if you just like it. And if you don't like it, have any question, please feel free to talk to me. And thank you very much for to be with me and watching this. Thank you.